in our conversation in the Transplant and Search Coordinators workshop run by the WMDA and EBMT, we spoke about the importance of collaborating really closely between international registries and our local transplant centres. From an Anthony Nolan perspective, we talked about really improving our collaboration and focusing not just on our core services, but on the additional services that we can provide. So Anthony Nolan provides search and selection services for our transplant centres in the UK and all of the expected usual provision and processes. But as a charity, we also provide a lot of patient services, and we fund clinical nurse specialists and clinical psychologists in transplant centres across the UK. We provide support for patients and patient information. We provide some grants for patients. So that's some of the additional support that we provide. But we're also working with our transplant centres on a partnership for improving how we work together, really transforming how we work with transplant centres. So we spoke about using technology in the Aspire programme that Anthony Nolan is working on, using technology to try and improve the processes, to streamline how we work with transplant centres, to move away from emails constantly back and forth to being able to access information together quickly and efficiently. And we also talked about our collaboration with University College Hospital in London. Anthony Nolan works with UCLH as part of our grafted identification advisory service. And this year, or over the last 6 months, we've been trialling a pilot with UCLH to embed one of our Anthony Nolan search coordinators as part of the team in UCLH. So I was also presenting with Juliette Lettier and Shari Denovan to talk about that pilot. And then the last thing that we spoke about in my presentation was about Anthony Nolan's continuing close relationship with transplant centres, and particularly our close relationship with nursing. We're in the process of hiring a clinical nurse specialist into the donor and transplantation services team in Anthony Nolan, which I hope will have us working more closely than ever before.